Hello again. We've gone through the labor process and the birth. We talked about natural ways to cope with labor and drugs that are available. And now I just want to spend a few minutes on, perhaps as a reminder for everyone to think about what will happen straight after the birth. It's not necessarily an environment or a phase that you need to prepare for a lot. But there are certain things that might be useful for you to pay some attention to in advance. I think perhaps because we all rely on that the people in the hospital will make sure that this is these are good minutes, that this is a good period for you and the baby. And mostly they do. Safety-wise, they do an excellent job. But I think all of us actually working in a hospital, being the one that helps to deliver the baby or has anything to do with the baby's care, if there is any challenges, usually midwives and doctors put most emphasis on that, on exactly that, the safety. And we sometimes forget that it's most of the time just normal. Birth is normal and the baby comes out, it's fine, it either cries or shows good signs of being absolutely fine. But we're quite busy with procedures and things we need to do, boxes we need to tick. So if you are the one that is not the staff, if you're actually the mum or the dad, maybe it's worth it for you to think about the environment. Think about the introduction to the life outside of the womb. Think about this baby that was inside you a few minutes ago. How little it's sensed of the outside world while it's in there, except for noise and motion. And now that it's coming out, that the smell, the temperature, the touch, the noises, everything is going to be totally new to the baby. And I say the duckling and the egg, but at least, most of us probably know this story, that the duckling, when it comes out of the egg, the first thing it sees is what it wants to follow. And for me, I certainly wouldn't want my baby to have the first thing it sees when it's born an anaesthetist, who might be a perfectly fine person, but I want the baby to see me and the dad. So essentially, you may need to think about this because everyone else will be sort of more busied with making sure that there's minimal bleeding, that the baby goes in the right hands, etc. So just to give you an idea of what will happen. So a baby comes out. I hope you can choose any position that you like when the baby's being born. But should it be that you are on your back or in this position, usually the baby's given straight to you. And babies are amazing. They immediately will, if something touches them or they're placed like this, they will rotate their heads and root towards the breast if it's there. So the baby will usually be searching and looking, and you kind of want to just lift the baby up and hold it there, because essentially it needs to be kept warm. And usually there will be a blanket or something that you will be given that you can place on top of it, and you just want to keep the baby safe there. And the sooner the baby goes to the breast, the sooner it sucks, the sooner the placenta can come out, because the suction of the breasts will release hormones that make the placenta, actually squeeze the uterus and help the placenta to come out. With this comes usually a little bit of blood, so if you're anything sensitive to that, and I guess I'm directing that to partners as well, perhaps it's not the time to look much at the vagina or that kind of area. Rather just focus on the baby. And then you will be asked about a few things at that point in time. So if you want to breastfeed, the sort of first answer to any question is, I'd like to keep my baby and breastfeed, thank you. The sooner you do it, the easier it is and better. But other things like vernix, vitamin K, bathing the baby, vaccinations, stitches, they may be things that the staff is asking you about. And normally, if it's your first baby, you may require some stitches. So you may have to be in this position for a while with your baby, and while somebody is stitching up the perineum. which is done with local anesthetic and normally done within 10 to 15 minutes or so. Not much pain involved for most people. But during this time, if you hold your baby, it's usually easier just to focus on that. You're more relaxed. Now, when the babies come out, they usually don't have elastic bands and dress on, but they are not covered, but they have layers of like a white substance that looks a bit like Vaseline, but it's white, and it's called vernix. This vernix helps the baby while it's in the uterus to be protected and helps the skin. And when it comes out, it is useful to keep this there and not wipe it all off, because it's like it's just a protection layer for the skin. So most of the time, if it's possible, we suggest putting a blanket over the baby, but leave it at that, not to wash or put the baby into a soapy bath. And you want to maybe later bath the baby, or if there's been a lot of blood, or if the baby poops soon after the birth, you may well want to. But to do that in the first hour after the birth is absolutely not needed. There's no hurry, and sometimes it's a very emotional moment. Ringing the parents or the grandparents and taking lots of pictures, it sometimes sounds very exciting, but I would also remind you of the book that I mentioned earlier in this series. If you're able to go back to this in time, later 20 years down the line, and if you can remember the moment when the baby came out and just what it looked and how you felt, it's quite amazing. Rather than thinking, oh, I'm talking to the grandparents, or all these staff are here and the lights are on, just think, you know what, take 5 minutes. Now the placenta needs to come out, and it usually happens quite on its own within 15-20 minutes of the birth. But in hospitals nowadays, there's a drug called oxytocin that is usually given intramuscularly to aid or help with the placenta being born. There are decisions that may be made about this period when the baby's coming out, or in the minutes after the baby has come out. And I would say they're usually something that you decide at the time on the day. But having thought about this beforehand and understanding your options, it may be helpful and may help you just to make it a little bit more peaceful. Thank you.